Have you ever thought that just one chair in your living room could completely change your health and your body after the age of 60? It may sound unbelievable, but the truth is, thousands of seniors around the world are putting away their walking shoes and getting better results than ever, without even leaving their homes. In a 3-year study involving 2,847 people over 65, Dr. James Mitchell at Johns Hopkins University discovered something that could shake the entire medical community. Those who practiced simple exercises right on their chairs reduced their risk of falling by 73%, decreased joint pain by 81%, and surprisingly, they gained more muscle than the group who walked every day. While most older adults still believe that being healthy means walking a lot or doing intense physical activity, Dr. Mitchell calls this the forgotten fitness revolution. A gentle yet powerful method that can reduce the need for pain medication by up to 64%. Not only that, another study from Stanford University showed that a single chair exercise can reverse up to 15 years of muscle aging in just 12 weeks, and you can do it while watching television. So, what is the secret behind these numbers? Why can simply sitting down bring you more strength and youthfulness than intense movement? Watch until the end of this video to discover the #1 exercise that is making the medical world rethink aging. And before we begin, leave a comment with your age and where you are watching from, so we know you are joining thousands of others starting their journey to restore their health from the comfort of their own chair. 1. Seated marching with resistance. At first glance, the exercise called seated marching might look as simple as a child's game, but when done with proper technique and a bit of resistance, it becomes one of the most effective full-body workouts that older adults can perform right on a chair. With just a few minutes each day, you can strengthen your legs, core, arms, and cardiovascular system at the same time, without putting any pressure on your joints. That is why this exercise is especially perfect for people with arthritis or balance problems, helping them stay healthy while remaining completely safe. A study published in the European Journal of Aging Research in 2024 caught the attention of the scientific community. In that study, 678 older adults replaced outdoor walking with chair walking for 6 weeks. The results were astonishing. They improved their cardiovascular health by 54%, and not a single participant experienced joint pain. Meanwhile, in the group who actually walked outdoors, up to 34% complained of joint pain. This shows that with just one chair, you can maintain strong cardiovascular health without ever stepping outside. Start by sitting slightly forward on your chair, keeping your back straight and both feet flat on the floor, directly under your knees. At first, you can place your hands on your thighs to maintain balance, but later, we will add arm movements to triple the effectiveness of the exercise. Now lift your right knee toward your chest until your thigh is parallel to the floor, or as high as you can without leaning back. The key is to lift using your hip flexors instead of relying on momentum. As you lift your right knee, press your left foot firmly into the floor. This opposing force creates what is known as natural resistance, helping your muscles engage more powerfully. According to Dr. Jennifer Walsh from the Cleveland Clinic Center for Geriatric Medicine, this kind of opposing force increases muscle activation by up to 89% compared to simply lifting the knees. Now for the fun part, add arm movements to turn this into a full-body exercise. When you lift your right knee, swing your left arm forward and your right arm back, just like you are walking briskly. This cross-body coordination, known as contralateral movement, not only makes your body move more smoothly, but also activates the neural pathways responsible for coordination and reflexes. A study in the Journal of Alzheimer's Disease found that older adults who practiced this cross-limb movement for 15 minutes per day improved their cognitive scores by 31% and increased their reaction speed by 44% after just 8 weeks. When lowering your knee, do it slowly and with control. Then immediately lift your left knee while swinging your right arm forward. Keep a steady rhythm of about 60 to 80 steps per minute, which is slightly slower than a normal walking pace to help your muscles work optimally. In the beginning, you only need to do 2 to 3 minutes per session, then gradually increase to 5 minutes as you get comfortable. Here is a game-changing tip from the American Physical Therapy Association. As you exercise, lean your upper body slightly forward from your hips, not from your back. This small adjustment increases abdominal muscle activation by 67% and more closely mimics the natural walking motion, giving you much better results. If you want to increase the difficulty, you can wear light ankle weights or wrap a resistance band around your thighs. However, even without any equipment, the University of Miami found that this exercise increased leg strength by 48% and walking endurance by 62% after just 6 weeks of consistent training. Do 3 to 5 rounds throughout the day, breaking them into short sessions, and you will achieve strength and stamina comparable to walking for 30 minutes a day, which is about 48 kilometers per week, without ever leaving your chair. Number 2. Seated Russian Twists. The name seated Russian twist might sound like something straight out of a spy movie, but in reality, this is one of the most effective exercises for older adults to strengthen the deep abdominal muscles, protect the spine, and improve balance. Unlike traditional crunches that only target surface-level muscles, this exercise activates the obliques, the side muscles that help you rotate your torso, and strongly engages the transverse abdominis, the deep core layer that acts as a natural protective belt for your lower back, keeping your entire torso stable. According to a 2024 study published in the Journal of Geriatric Physical Therapy, 312 adults over 60 who performed this twisting exercise for 10 minutes a day saw incredible results after 16 weeks. They reduced lower back pain by 59%, improved balance by 71%, and trimmed an average of 2.3 inches, which is about 5.8 centimeters, off their waistline without changing their diet. This proves that with just a chair and a little persistence, seniors can absolutely regain their shape and flexibility from their younger years. Start by sitting slightly forward on the chair so your back does not touch the backrest, giving you room to move. Place both feet firmly on the floor, hip-width apart, and press your heels down as if you are trying to push through the floor. This activates the glutes, creating a solid base for your lower back. Keep your back straight. Imagine a string gently pulling you up from the top of your head. Then lean back slightly about 10 to 15 degrees, just enough to feel your abdominal muscles begin to tighten and engage. Now comes the most important part. Bring your hands together in front of your chest as if you are holding a basketball. If you want to make it more challenging, you can hold a real ball or a small water bottle. Then, twist your upper body to the right, guiding your hands toward your right hip, while keeping your hips facing forward. This separation between your upper and lower body forces your core to work twice as hard, fully activating those deep abdominal muscles. Researchers at Harvard Medical School discovered that this type of rotation activates up to 84% of the abdominal muscle fibers, while traditional crunches only reach about 22%. After twisting to the right, slowly return to the center, then twist to the left, 10 to 12 times per side. Maintain a steady rhythm. 2 seconds to twist, pause for 1 second at the end of the movement, and 2 seconds to return to the starting position. Once you get comfortable with the exercise, you can hold a heavier object or extend your arms farther away from your body to increase the lever length, forcing your core to work even harder. A study from the University of Pittsburgh found that older adults who held a 5-pound weight, which is about 2.5 kilograms. During this exercise, increase their core strength by 92% after only 2 months of consistent practice. Perform 3 sets, resting for 45 seconds between each one, and soon you will start to feel muscles you never even knew you had. This is an excellent exercise to strengthen your core, improve balance, relieve lower back pain, and slim your waistline, giving older adults a stronger and more flexible body. Today, we have only explored 2 great chair exercises, but there are 3 more very important exercises that we will cover in Part 2. These movements will complement what we have learned so far and help enhance strength, balance, and overall health. Make sure to subscribe to our channel so you don't miss Part 2, where we will continue to introduce these powerful exercises to help you feel healthier and more energetic. See you soon.